Preet Kaur Gill. Go on, Preet.
Thank you, Mr Deputy Speaker. This week is Mental Health Awareness Week, and I fully support the need to break the stigma and talk about our own and others' mental health. Public health has an integral role in improving young people's mental health. But we live in a country where, because of the actions of the party opposite, the funding and ability to access care from trained professionals is being decimated. But what happens when we realise we need support? How long do we have to wait for help? And what are we doing to provide support for those people who are struggling and their families who are left to cope without sufficient support? How does the government expect to provide the support, given they have cut £700 million in cash terms of the public health grant to local government between 2015-16 and 19-20, according to the LGA, of which I am a Vice President? Today I want to speak specifically about children and young people and mental health. NHS figures show that 1 in 8 people under the age of 19 in England have a mental health disorder, and half of all mental health problems start before the age of 14. I recently conducted a survey of schools in my constituency. In 10 of the 11 schools who have responded to the survey so far, the number of pupils suffering with mental health problems have increased over the last 5 years, and one saw a 15% increase in the last 12 months alone, and all but one have seen these cases becoming more severe. I want to place on record my thanks to the Honourable Member for Ogmore for his chairing of the all-party group on social media and young people's mental health and well-being, whose recent inquiry found that 27% of children who are on social network sites for 3 or 4 hours a day have symptoms of mental ill health. And this stands against 12% of children who spend no time on such sites. The government's own online harms white paper concurs with research by the Royal College of Paediatrics and Child Health, which reported that there was moderately strong evidence for an association between screen time and depressive symptoms. The government needs to take real responsibility for the children in this country and their well-being. Instead, we have heard that they will support further research without saying what that will be, and that they welcome industry efforts. What parent would feel reassured by that? The industry has taken some steps to regulate themselves, but it is obvious that it is not doing enough. Public health cannot be left to businesses, and with the mental health of children and young people at stake, we need to look at the different contributing factors. It is not enough to simply acknowledge the problem and not address what is seen to be one of the growing risks to our children's mental health and well-being. And let's take the next step of the process. When a child has mental health problems, how are they identified? It's teachers, often those individuals on the front line most likely to support the need, working with larger classes and increased pressures without teaching assistance or additional support. Schools in my constituencies and many across the country are doing an amazing job at trying to provide appropriate provisions for their pupils to deal with mental health problems, from developing their own wellbeing support to check-in sessions and peer mentors. But this is not sustainable. Schools in my constituency told me that immediate support is usually unavailable to vulnerable children and parents. Response times from overburdened mental health agencies are poor, there are long waiting lists, and early help support is limited. And because of the fall in the ability to access core public health services, schools are forced to pick up the slack despite often not having had the appropriate training or resources to do so. A quarter of 11 to 16-year-olds with a mental health disorder have self-harmed or attempted suicide, which rises to as high as 46% among teenage girls with a disorder. And the Children's Commissioner said there is a danger that we continue to have a system that fails to help children until they are so unwell that they need specialist intervention. Funding pressures mean many councils are being forced to cut early intervention services which support children with low-level mental health issues and avoid more serious problems in later life, which cost far more over coming decades. If we are to improve provision of preventative and early intervention services, then it is vital that the government adequately funds public health in the forthcoming spending review, as reducing spending on public health is short-sighted, irresponsible at the best of times. Thank you.